Good morning. It's still morning in Estonia from me as well, and thank you very much for inviting me to present my research on new family doctors. My name is Marta Velgan, and I work as a GP or family doctor in Estonia. And I also am doing my PhD at University of Tartu, and the topic of my PhD is family doctors shortage in Estonia and Europe in general. So with our study, we wanted to see what is Estonian new family doctors' motivation and readiness to work in Estonian primary healthcare. And we did a qualitative study on this topic. So first, the shortage of family doctors is a known problem in Estonia and also worldwide. We know that the number of family doctors is not growing as fast as other doctors. And although the number of young doctors who would like to become family doctors in Estonia has increased, we still have quite a lot of difficulties with finding replacement for doctors who are leaving. And we know that family medicine or primary healthcare is a very important part of healthcare system. So when we have a shortage of family doctors, it is a potential threat for the services provided by primary care, but also by extension for the whole organization of the healthcare system. Primary healthcare in Estonia, our family doctors work as independent practitioners. They don't work in the hospitals. And every doctor has their own list of patients. And the list of patients is usually up to 2,000 people. Family doctors either work alone or they work in a group practice. And usually they have a contract with the Estonian Health Insurance Fund, and all the funding comes from the government. The average age of Estonian family doctors is currently 57 years, and we know that around 1/3 of family doctors are in retirement age. As of 2019, family medicine residency in Estonia is 4 years, and each year around 35 new doctors are starting family medicine residency. But still, we have a lot of patients who don't have their own family doctors because it's very difficult to find a new doctor for some lists of patients. So our aim for the study was to see and describe the factors which are influencing our new family doctors' career intention and their readiness and motivation to start working as independent practitioners. We asked them what kind of job opportunities they see and what are their plans after they are finishing family medicine residency, and also which kind of factors influence their career intention. The study was a qualitative study. We did 6 group interviews with family medicine trainees and also family doctors. We had altogether 25 participants, and all the interviews were audio recorded, afterwards transcribed, and we performed a thematic analysis with three colleagues. And after analyzing the data, this is what we found. The data was, we found that there were 4 bigger teams, like personal life, future workplace, process of starting to work as an independent practitioner, but also preparation for the work of family doctor. And under these bigger teams, there were smaller sub-teams. I will talk more about these teams and sub-teams, which we found important in motivating family doctors to start working as independent practitioners. So what we saw, or what the family participants were talking about, is that usually when they start family medicine residency, they are starting it with an idea that in the future they will work as independent practitioners, and at one point in the future they will take their own list of patients. Because without the residency, they can still work in different places as a doctor, and they also can work as in family medicine, but they cannot own a list of patients, and they cannot have their own family medicine clinic. But although they think that they will do that in the future, they don't want to do that right away after finishing family medicine residency. And the main reason why they don't want to do that afterwards is family planning. Most of our family doctors are female, and usually in the age where family planning is done. So some of our participants said that they are thinking of taking the list of patients after they have had enough children, but before that, taking a list of patients seems too big of a responsibility. Something that we also discussed is how residency is preparing them for all the roles of family doctor, as usually after they finish family medicine residency, it is we want them to take the list of patients and start their own clinic. But what we found out is that family medicine residency does prepare them well for clinical work of family doctors. They usually get a very good clinical base, but it doesn't prepare them very well for the non-clinical roles of family doctor. How to manage the clinic, how to manage the list of patients, how to go through the process, how to find personnel, etc. So this is something that they haven't seen very much during their residency, and they don't feel very confident that they will do it well. And seen as in family medicine residency, they have seen also how family doctors work. They have seen that working alone can be quite overwhelming with a lot of responsibilities, and it's raising the risk of burnout. And our participants said that if they start working as a family doctor, they still want to have time for vacation, time for free time for conference, and they are afraid that it will be very difficult to have that. And also they have seen their colleagues starting their own clinics with their own list of patients, but after some time giving up. So this raises also some concerns. Family doctors also see that the career of family doctors is linear, not vertical. So at the end, or the peak of career, is to have their own clinic, to have a list of patients. And as there are not more steps after that, they feel that they don't have to achieve it right away after residency, but they still have the time to do that in the future. We also asked what would motivate them to take the list of patients earlier, or they spoke about it themselves. So, and it's something that maybe the government or also other parties can do. As I said before, that new family doctors are afraid that they will not have enough time for vacation, for conferences, for whatever other things they want to achieve. So something that they see that would help them would be a very well replacement system for if they need a doctor who would replace them for a day or week or whatever. It will be very easy to find those doctors. Right now it's very difficult, as every doctor has to try to find themselves the replacement, and it's not always very easy to do. The process of taking a list of patients and starting their own clinic is quite bureaucratic, and usually they have to go to fill a lot of papers, documents, to sign a lot of contracts, and it can be quite overwhelming, especially if there is not good information on what they have to do. So they see that they would like to have more support from the government or from colleagues to start their own clinic, to take a list of patients, and to help them with the management at the beginning. And usually when family doctors in Estonia start their own clinics, they have to buy their own equipment to furnish their own clinics. So it means that they have to have quite a big initial capital for that, as family doctors in Estonia are seen more as entrepreneurs. It is something that they have to have their own, and new family doctors usually don't have a lot of free money to do that. We do have some support for family doctors who work outside of Tallinn and Tartu, outside of bigger cities, but also family doctors who work in bigger cities still see that this kind of support from the government would be very, very good. And as mentioned, all the problems beforehand, our participants said that if they would work somewhere, they would prefer to work in group practice, as the problems that I mentioned before would be smaller or would be not so visible. That in group practice it will be easier to start working as a doctor right away, because you don't have to buy your own equipment or furnish your own rooms. It will be also easier to find replacement if you go to a conference or vacation, and also doctors in group practice can focus more on doctor's work or clinical work, and the non-clinical management work they can leave it to someone else in the group practice. So this is something that a new family doctors see, that in the future they would prefer to work in the group practice. So in general, what we discovered, or what we saw in the study, is that in general, new family doctors want to work as independent practitioners with the list of patients, but they don't want to do it right away after finishing family medicine residency, but maybe in the near future, in 5, 10, or 20 years. And the main reason why they want to postpone taking a list of patients is family planning, but also they don't feel 100% confident that they can fill out all the roles that are necessary for family doctors' work. So they want to first get used to the work, and then maybe in some years we'll start thinking about that. And from government point of view, it is important to create conditions and different ways how to support new family doctors, and how to increase their motivation and willingness to start working as independent practitioners. Thank you. And if there are any questions, I would happy to answer them.